Welcome again to Save Your Money, Save Your Teeth here on E-Radio. It's our go-to podcast where curiosity meets dentistry, straight from the experts. I'm Ian, and it's time for us again to chat to Dr. Clifford Yudelman to take a nice deep dive into the world of dental care from a consumer's perspective. Dr. Yudelman is, of course, from OptiSmile. Whether you're looking to brighten your smile or protect your wallet, we've got you covered with practical advice and the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. Dr. Yudelman, welcome again. Welcome back.
Thank you. Thanks for having me back, and looking forward to today's episode on Invisalign again, this time about deciding on treatment and a little bit more details about the actual treatment.
So yes, Dr. Yudelman, I want to ask you, why is choosing Invisalign an important decision for those looking to enhance their smile?
So Invisalign offers a clear and a discreet way to get a smile, a straighter smile without using metal railway tracks or traditional braces. The patients experience the freedom to live their life without the self-consciousness that often patients are self-conscious about their skew teeth in the first place, and then putting metal brackets and wires on for 12 to 18 months can be even more traumatic. So with Invisalign, it's almost invisible, it's clear and it's discreet, and a lot of people won't even notice that you're straightening your teeth, and you start to see the results after 4 to 8 weeks. A lot of problems in the front already start looking better, and of course, because there's no metal brackets and wires, the beauty starts to emerge like a butterfly coming out of a cocoon. And Invisalign's advanced technology is very precise. It's customized just to each individual, and choosing Invisalign is an investment both in your confidence and in your long-term dental health. So I think it's a very important decision.
So now, doctor, how do you assess if a patient is a good candidate for Invisalign?
So we assess the complexity of the dental issue and ensure that Invisalign can deliver the desired results. There are very, very few cases these days with the latest versions of Invisalign that require some other treatment. Invisalign can handle almost any type of malocclusion or skewness in teeth. The patient's lifestyle and commitment level are considered to gauge their compliance with wearing aligners, that we'll talk about a bit later. And we also evaluate, the oral health to ensure there's no underlying conditions that can interfere with treatment. And our goal is to match the patient's expectations with what Invisalign can realistically achieve and create a clear path forward.
Okay, and what is the initial consultation process like for Invisalign? Can you talk us through it?
Yeah, so we start off with a detailed discussion about what your smile goals are and your concerns. And then we do a comprehensive oral exam, and we use 3D digital scans with the iTero scanner, which has tools on it, something called an occlusogram, where it's like a heat map. It shows us which teeth are hitting and shows us teeth that are hitting that aren't supposed to be hitting. And it's a touch screen, and we can zoom and turn around and look at top and bottom and from the inside. And the patient really, for the first time, gets to see what their teeth look like. The patients will get a customized treatment plan, including an estimated timeline and expected results. So there's something unique to Invisalign. It's called an outcome simulation. So after we scan you, we push a button or we touch it on the touch screen. We push Invisalign outcome simulation, and it creates a simulation as if we're designing a new Invisalign smile for you. And on the latest scanner that we have one of the few in South Africa. It's called the 5D, the iTero 5D. We have Outcome Simulator Pro. So we take a picture of you with an iPhone app or with a Android app, a big smiling picture. And by the time we scan you, we can then see what your new teeth will look like, or your new smile will look like in your face, in your own mouth. And we can adjust it on the models, and it changes it in your mouth. So it's not just photoshopping, it's actually using AI and 3D tools to do this. It's very unique. Only Invisalign has that. And we end up explaining all the next steps and make sure that the patient's informed and confident.
I like how patients can see beforehand what it will look like. I think that's very, very nice, thanks to modern day technology. How do you, Dr. Yudelman, help patients set realistic expectations for their Invisalign treatment?
So we provide a completely transparent overview of the treatment process, including any potential challenges. Like I said, we show you digital simulations. We discuss the commitment required to wear the aligners for the recommended 22 hours a day. So if you don't think that you'll be able to comply with that, then it's better not to go ahead. So you do need to wear them all the time, except when you're eating or cleaning your teeth. If you only wear them 18 hours a day or overnight, or you don't comply, it doesn't work, and it's a waste of time and money. And we also explain to you what the process involves, which means Invisalign has what's called custom attachments. They're designed, especially with AI. Every different tooth has a tiny little attachment. Not all teeth need attachments, but they are tooth-colored bits of plastic that get bonded onto your teeth, usually at visit number 3. And we show you what those look like on a model. We can only show you exactly where they're going to go on your own teeth once we've submitted it to Invisalign and we've done your plan. And we also explain to you something called IPR, which is where we polish between the teeth to make sure that they don't knock into each other. And it's very, very precise. It's 0.2 of a millimeter or 0.3 of a millimeter thinner than a fingernail. And this is done at certain times, and it's all digitally simulated and controlled. It's not a random thing. And we also talk about the continuous support and the regular checkups that we'll do for you. We emphasize that, that helps keep you motivated and on track.
That's great. And what are the financial options available for patients considering Invisalign?
So at OptiSmile, we offer flexible payment plans tailored to fit different budgets to make it accessible. There are discounts for paying up front, where patients get a 15% discount, which not many practices do. There are also options to pay over 12 months, and we provide any information to you so you can see if your medical aid might cover. Some medical aids pay for braces, in which case they will also pay for Invisalign, usually only up to about 35,000 Rand a year. And we always work closely with patients to try to find a solution that fits with their particular situation. We also have outside financing available for patients that need to look at other options.
Okay, that's fantastic. And now for the preparation process, how do patients prepare for their first set of aligners?
So we, up to the point where the patients have actually got their scans, and then we've showed them either virtually or they come in. We show them on a Zoom or a Google Meet, or they come in, we show them their clin check, which is their particular plan, exactly how many aligners, when we're going to change it. We've sent them frequently asked questions and brochures. They've had a number of discussions with us, so they're usually quite ready for that. But a couple of days before the first appointment, we send them more detailed instructions on how to put them in, how to take them out, how to clean them. We talk about something called chewies, which are like a little polystyrene or like a little rubber. It looks like a mini pool noodle that you bite on every time you put your aligners back in. You chew on it for 10 or 20 times, and then we give you specific instructions on using this chewy. We make sure that that there's enough time to show you. We make sure you can get your aligners in and out. We encourage you to plan your meals and snacks around the wear time. We also send you a link to a video and information on how to get set up with what's called virtual care, which is where you'll take pictures every week of your aligners before you change to the next one, and we can track it using AI. So, we just help you to prepare mentally for the commitment of wearing these aligners. Most patients are very excited and they don't have a problem. It's really very simple. There's nothing really much to it. We always make sure that the first 2 aligners, there's no attachments, there's no IPR. You basically come in and we give you, comes in a beautiful, it's like unboxing a new iPad or something. There's a beautiful box and a special case. We give you your chewies and a silk bag. We put your extra aligners, your second week of your second set of aligners in there. The aligners come all sealed and numbered and packaged. We only usually give you anywhere from 2 to 4 at a time. So you go away for a month or sometimes a little bit longer if you're using virtual care. But we take care, we hold your hand every step of the way. We check in with you after a couple of days to see how you're doing. You have either my number or Dr. Harris or Dr. Kira, Dr. Cara. There's 4 of us that do Invisalign. You have our personal WhatsApp numbers should you have a question. So we really try and look after patients.
I love how you go with them every step of the way. I think that's so important. Well done. What kind of support is also available to patients during their Invisalign treatment?
Yeah, so in addition to what I just said, we make sure. So in the States where they've been using virtual care for a long time, especially since COVID, they'll sometimes give someone all 14, if they've got 14 aligners, and send them on their way and book them back in 14 weeks' time. We find we have a combination of the two. We like to judge patient by patient. Some people are very adaptable and very good at doing things, and other people, especially like older patients, they really want to make sure that they're doing it properly. So they'll come in after a month. After anywhere from 4 to 8 aligners, we do something called a progress assessment. We scan you with the iTero with your aligners out. And then it goes onto the cloud, and say you're now on aligner number 8. It pulls in where your teeth should be on aligner number 8, and it overlaps or compares where your teeth are now to where they should be. And then everything that's moving exactly according to plan. Now, remember, it's very, very, very accurate. None of the other systems have this. So it's accurate to 0.2 of a millimeter. And we can see if a tooth is supposed to have moved half a millimeter or 0.8 of a millimeter by now, and it's only moved 0.7, it will actually show us, instead of green, the tooth will show up as yellow. And then we could say, are you wearing these 22 hours a day? Are you are you only wearing them 20 hours a day? And we give people some coaching and encouragement, motivational tips. We also, in certain cases where patients can't, just for one reason or another, can't get in the full 22 hours, we might advise them to slow the treatment down and to rather change their aligners every 10 days, and in some cases, every 14 days. So obviously, the more you wear them, the quicker it goes and the sooner you can change them. If you're not wearing them and they're not tracking according to plan, then you're going to end up taking longer for your treatment. So people have to choose, which route they want to go. But we celebrate milestones together. We keep the patients engaged and excited. And like I said, WhatsApp support. They've got the practice WhatsApp number. They've got my number. They have the other dentist number, whoever's treating them. We make it as easy as possible.
Fantastic. Can you also share some success stories with us from patients who chose Invisalign?
Well, I'd like to say that every story, every patient who we've ever done Invisalign on is a success story. patients have invested a lot of time and commitment, whether it's Invisalign Light, 14 aligners, or Invisalign Moderate, 20 aligners, or a comprehensive case where they're going up as many as 30 or 40 weeks, and some patients even longer if they have severe, bite or bad malocclusions. And depending on how skew the teeth were and how it affected the patient's confidence, every single patient gets a gain in confidence. I've mentioned in previous podcasts that we've had patients that towards the end of their treatment, they're now engaged or they have a new relationship. People they go back into the workplace. If it's an older patient, maybe a lady that's taken time off from work and had a couple of kids, and now the kids are 9 or 10 years old, and the patient's in her late 40s or 50s, and they haven't worked in a while, and they're lacking confidence. They get their teeth straightened, whitened. In many cases, we do a little bit of injection molded composite, which we've discussed, and we see a change in every patient. I think, like I said, every patient is a success story and a transformation. There's patients who were anxious about orthodontic treatment, and they just find it life changing because it's clear and nobody can see them. And then obviously in teenagers who can be very shy, if a front tooth is biting behind another tooth, or they have a lot of gaps, or their teeth are very crowded and they're always covering up their mouth, by the time they're done, and in teenagers it can go very quickly. They come in, they're wearing some makeup, their hair looks beautiful, and they really have come out of their shell. And the parents tell us how it doesn't disrupt their school and their sporting activities. I know I sound overly positive, but we just love doing Invisalign. The patients love it, and although it's a big investment financially and time-wise, the rewards are bountiful.
Sounds amazing. Also, Doctor, what common concerns do patients have before starting Invisalign, and how do you address them?
So patients often worry about pain or discomfort. So we explain how the each aligner puts very, very, very gentle pressure on the teeth. With generic aligners, they cannot get it as accurate. They don't have what's called smart track material. Invisalign researched almost 400 materials before they came up with the special material. They've done 19 million cases, I was told at a lecture that I went to yesterday. They've done a lot of research. They've got what's called smart staging, which they stage each movement very precisely. So the generic aligners, you change them every 2 weeks, and they can sometimes push on your teeth up to 0.5 millimeter, which is quite a lot of pressure, which means every 2 aligners are trying to push your tooth 1 millimeter, whereas with Invisalign, 1 millimeter movement will be set up over 5 aligners. So it's very gentle pressure. When patients get the first few aligners, we encourage them to take Panado if they have like a dull ache or any tenderness in their teeth. We try to avoid aspirin or non-steroidal anti-inflammatories like ibuprofen. We address any concerns. They can look in the mirror and see that it's just really very discreet, and any questions about effectiveness are answered, and we show them other successful cases. But we always make sure they understand the time commitment and try and give them tips on how to wear them effectively and not let it interrupt their life.
And the final question for today: how do you ensure patients feel confident and, very importantly, comfortable with their decision?
So at the initial consultation, it's completely no pressure. It's a no pressure environment. We allow a lot of time. We spend an hour to an hour and a half. They also get to spend up to an hour with a trained treatment coordinator. At OptiSmile, Verona has had a very extensive Invisalign case, straightening her own teeth, and she actually is wearing Invisalign at the moment, so she's able to, explain to them from a personal point of view what was involved. We build trust by giving them thorough information and addressing any concerns up front. They get to feel what an aligner feels like, and we reassure them, that we have ongoing communication and support. We guarantee that, so they're never alone in their journey. Unlike in the States and the UK, they've got these direct to consumer aligners where you cut out the middleman, and the middleman is the orthodontist or the dentist. That's the most important part here. So cutting out the middleman isn't really the way to go when it comes to straightening your teeth. Luckily, in South Africa, we don't have that, but some of the generic aligners that some dentists that don't really have the experience, are providing is a similar. It's almost like a mail order thing. They scan you, they give you your aligners, you go away, you come back, they're going to scan you again and order more. And it's not as sophisticated as Invisalign. From what we've seen, we don't offer those at OptiSmile.
Well, thank goodness. So we're in South Africa.
Yeah.
And yes, that wraps up another edition of Save Your Money, Save Your Teeth. Dr. Clifford Yudelman, once again, a big thank you to you for sharing your expertise with us.
Thank you very much. And I look forward to next week for our final episode, number 6, on straightening your teeth, more about Invisalign, life with Invisalign, and more in-depth information for people who by now are seriously thinking about it. So keep well, and we'll speak to you next week.
Absolutely. Certainly looking forward to that. And also a big thank you to our listeners for tuning in. Remember also, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe to our podcasts for more advice also, and more enlightening discussions. And then join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.